Somebody not getting in an order for a medication or not showing up for visit, you can measure that.
Right.
You can't measure respect or disrespect. You can't measure attitude, but the family can feel it. The greatest fear for a gay and lesbian couple or a trans couple or any other member of the community is that we are going to be disrespected and that you're going to care for us differently than you would somebody else.
Welcome to the Heart of Hospice podcast. I'm Helen Bauer. In this episode, social worker and grief counselor Jill Johnson-Young is back with us sharing wisdom and her perspective on end-of-life care for the LGBTQ community. Whether you're a family caregiver or an end-of-life professional, the Heart of Hospice podcast is here to enhance your hospice experience by connecting you with information you can use about end-of-life care.
This episode is sponsored by BeyondWordsCo.com. Beyond Words ensures no one feels alone through life's hardest times. Their care packages support those going through grief, loss, or difficult life transitions. You can also send a care package for birthdays, retirements, promotions, well wishes to encourage, say thank you, or just show appreciation. Order your custom care package at BeyondWordsCo.com.
Today's guest is a return guest. This is a record for the podcast. She has been on twice. This is her third conversation with us. I'm so excited to connect again with Jill Johnson-Young. She's an author, speaker, she's a grief expert, and a death educator. And she's also a therapist who specializes in grief and loss. She's the author of several books, including The Rebellious Widow and Your Own Path Through Grief, which is a grief workbook. She's got books for children as well. And she's just an amazing lady. She's had a unique life, and she's openly sharing what she's learned, not only as a hospice professional, as a social worker, but also as a hospice caregiver for her two wives who passed away on hospice with terminal illnesses, and how those experiences flowed and how she was influenced by them, and how the interactions from the team affected her personal hospice journey. So here's my conversation with Jill Johnson-Young. Jill, welcome back to the Heart of Hospice podcast. It's so great to talk with you again.
Thank you for having me. I love being here.
It's awesome to see your face, that smile. Even though we're disconnected, Zoom is a really good thing.
It's a beautiful thing. I am liking it more and more, even though the pandemic is officially over.
Oh, isn't that a nice thought?
It is, but I like the connection, and I like connecting with people around the world. And doing the visual.
Yes. And I'm so glad you agreed to come back on the show. This is your third time on the Heart of Hospice podcast.
I'm so excited.
That's a record. I don't think I've had a guest on that many times. So you're like the first, you're groundbreaker. I like it.
Thank you. Me too.
Well, we're going to jump into today's topic. We've got a big topic today, something we've never talked about on the podcast before. Very important, very timely. And in your work as a hospice social worker, grief counselor, out in the hospice community as a caregiver yourself and a spouse of someone who is on hospice, you're the perfect person to talk about this. So we are talking about caring for LGBTQ community members at end of life. Mm-hmm. And there's quite a bit of buzz around this topic these days. So we thought it would be a good idea to tackle it.
That's awesome.
Why do you think end-of-life teams are challenged when they're providing care for patients and caregivers that are in the LGBTQ community?
The thing that I see the most, that I saw the most as both the spouse who had someone on hospice twice, because I've been widowed twice, and as a hospice social worker, and now as a grief therapist who's absorbing people's stories, is that everybody comes into work with their own biases, and that's escalating right now in the current political climate. And that's not a political statement, that's a reality. And because of that, there's a sense from some staff people that they have some kind of magical right to decide if a couple or if a person in that community should be part of that community, if it's okay to be part of that community. There's like an inherent allowing of judgment despite what any hospice's policies might say. There's a sort of a sense of, I get to decide if this is appropriate. I get to decide if I agree. And they use that word lifestyle, which is abhorrent to anybody in the community. That is not a word that is well accepted. It's not something that I've ever heard anyone in the community appreciate anybody leveling. It's seen as sort of an insult. Actually, it is seen as an insult.
Yes.
And so when they've got a staff person who comes in from that lifestyle kind of perspective, they don't provide and afford the same care and dignity that they would for any other hospice patient, especially if it's a couple.
So let's talk about coming in with a bias like that, because as a nurse, one of the things I was trained to do 30 some odd years ago was you come in, everyone is equal. Mm-hmm. You care for white, black, Native American, Pacific Islander, gay, straight, trans. Everybody's
rich,
the
poor.
same. Exactly.
Mm-hmm.
Educated, uneducated, rural, urban, old, young, you know?
And there are a phenomenal number of hospice people who see it that way. That is how they approach hospice care. That's how they approach nursing and chaplaincy and social work and home health aid and all those things. And those people do it beautifully.
But not everybody can do that.
Not everybody will do that. And that's where it's not lifestyle, it's their choice.
Exactly.
And it's amazing to me how many feel like they can do that. And the problem with them doing it is, particularly for the seniors and middle-aged folks in the community, there's a palpable fear about saying anything, about calling in the complaint, because they don't want their loved one to be treated badly in the future. And they don't want pain management to disappear, particularly as a consequence of saying someone's not being respectful. And respect is not something that you can compute, right? Somebody not getting in an order for a medication or not showing up for visit, you can measure that.
Right.
You can't measure respect or disrespect. You can't measure attitude. But the family can feel it. And it's something that is really, for that group, it's really hard for them sometimes, because those who are over the age of about, 65, remember when they could actually be locked up in a psychiatric hospital with the key thrown away just for being out.
Right.
And the rest of us who are in the middle age group, I'm coming in on 60, we had to fight for basic rights. When I was in college, I couldn't apply for jobs that I wanted because I couldn't pass a security clearance because gays and lesbians were not allowed. And certainly trans was not even that wasn't even spoken, right? There were, we had drag queens who were a beloved part of the community, which is also something that's not understood by many other people outside the community. Drag queens are part of us. They're the ones who created the ruckus on Christopher Street. We owe that to them. Drag queens of color are the ones who actually are the first ones who fought back. So they should be revered, but they're not revered by the outside community.
Right.
And when hospice teams come in and they don't have that history and they don't know those things about us, they can't relate, and they say things that they think are acceptable, but in fact are hurtful. And I think one of the best examples is when my wife Casper died. She was a hospice nurse. She was part of the team who took care of her until she had Lewy body dementia. And the day she was dying, one of the old team members came by, who was also a nurse who took care of my first wife. And we had our wedding pictures on the hallway going down the stairs, because we had that big formal staircase you should always put the pictures on, right? And decorate for Christmas and do all those things, right? And I did. I hung all the stupid garlands every year. We moved and I threw them away. I was so excited. Took care of that need. Anyway, Cheryl was going downstairs and she said, I've always loved the two of you, but I've never agreed with you being allowed to be married.
Wow.
She'd gone to our wedding.
It seems to be, there's a sense of entitlement. I'm entitled to voice my opinion. I think that's the difference. You're entitled to have an opinion.
But not tell me about it.
No, absolutely.
Yeah.
Would you go into a patient's home, say they were hoarders, or it was a very poor household? Would you go in and say, I've never approved of people that hoard. It's just a filthy habit. You need to clean this place up.
Or how could you have not pulled yourself up by your bootstraps and, gone an education? How could you have lived? I wouldn't even think those thoughts, but somehow there's an inherent okay to do that towards the LGBTQ community. And it's getting worse right now because of all the laws coming up that have been passed that are pushing things backwards. We've got Supreme Court justices saying that they don't want gays and lesbians to be married anymore. And it's giving sort of free rein to those who have a bias to feel like they get to say it at any time and anywhere. And employers are somewhat leery of contradicting them because they're afraid they're going to get sued by their own employees. But that leaves the patients and their families in this really ugly kind of a limbo and not sure where they stand.
I'd like to touch on that. So these older folks that we take care of that are in the community, when you talk about trauma-informed care, these are people that have experienced traumatic life events due to their LGBTQ status.
Mm-hmm.
People that don't want to talk about it. They're reserved. They don't share their medical histories fully. And I think it's such a big challenge to bond with a hospice team.
Mm-hmm.
And these are the majority of who we're serving. I mean, almost all of our patients, I think only 2% of our patients in hospice are pediatric. So we're serving a great number of these older LGBTQ community members. So the effects of the care that they allow themselves to receive and the care that they do receive, what are the effects? What kind of effects do we see on the end-of-life care that they're provided with?
For the members of the community, there is an inherent distrust because that's also the community that remembers the beginning of the AIDS crisis.
Yes.
When doctors literally wouldn't touch a patient. And it was literally the lesbians who came through and took care of the gay men because there was nobody to do it. And I was a social worker for our AIDS project at the very beginning of the virus. It was ugly. And there was so much bias. A lot of those folks died. We lost most of our people who ended up with HIV/AIDS. But that's not been forgotten. And so there's this, okay, you say you're here and it's been 40 years and we should be able to be okay with this, but I don't know where you stood then and I don't know where you stand now. They really need to hear that the team members, their primary team members, are really good and comfortable with who they are, all of who they are. And that there's none of the even underlying judgmental language used, right? It's, how do you want me to refer to your partner as your partner, your spouse, your husband, your wife? What would be good for you? What terms do you guys use? Right?
Yeah.
Let's bring it out.
Yes. A compassionate, respectful.
Yeah. To the kid, this is your dad, but is this your pops and that's your dad? Or if you've got two dads, how do you refer to them?
Right.
Right? If someone is trans and their birth certificate doesn't match, the social security number and the name, that's a great way to be discriminatory, because then you can say, no, we require that people use the name that's on their insurance card. Well, why would you do that? You don't refer to every William as William. You call him Bill.
Exactly.
Right? You call Harry Huck. Why would you insist on that? But for you have a bias, and now you've got a way of showing it.
Right. It's just an outward expression of your prejudice and your judgmental belief. Absolutely. Absolutely.
And it's reinforcing the trauma. And the trauma is, I don't know how much I can trust you. I don't know how much I can tell you. I don't know how much I can say, because I don't know how much you're respecting me and how much you're not.
So it ties the hand of the...
I was in a different position. Yeah, I knew the team. I was in a different position, but it's really different when you're not part of the team initially.
But it's interesting that Casper was actually part of the team that was taking care of her. These were her coworkers, her in hospice, it's a work family.
And she was a favorite. Yeah.
Her coworker was comfortable saying that. Mm-hmm. I find that pretty amazing, I have to say.
I did not throw her out, but I did escort her out rapidly.
Yeah.
And she had the nerve to come to the service, and I did not speak to her. Because seriously, why would you think that you could show up and basically pretend to be mourning someone when you didn't love them for who they totally were?
Right.
And Casper went through a sincere amount of trauma when she lived in North Carolina because she was a lesbian. She was very clear, you may not take my ashes back there. I want nothing to do with that state anymore. Mm. And, as a Southerner, for a Southerner to say they don't want to go home, there's got to be trauma.
As a Southern girl, I guess I have to agree with that one. That's true.
Right?
That's true.
You want to go home to be buried or interred or scattered. And she's like, no, you can take me to Hawaii, but you cannot take me back there.
Patients come to us with these experiences, and everything that's happened to them along the way, whatever baggage they pick up, they've got healthcare baggage. If they've had a chronic illness that became a serious illness, that it has to shape how they interact with their hospice providers, how much they disclose, and how willing they are to access it. So I do want to talk about that. Do you think there's underutilization in the LGBT community when it comes to accessing hospice for end-of-life care?
I think there's underutilization, and I think when there is utilization, a not insignificant percentage choose to go back into the closet in order to utilize services. There was just a big article in, was it the New York Times or one of those publications this week, that talked about when it comes to senior care and end-of-life care, how many people in the community go back into the closet in order to be safe in their senior years and at end of life, because they can't even share housing. If one needs placement, the placement facility will deny facility access to the partner.
Wow.
Because discrimination is legal.
So it takes away your caregiver. It takes away your sense of self. It takes away your emotional support.
Your primary support, the hand that holds you.
Yeah. So many losses. Yeah. Your advocate, and at some point your voice. Whoever's going to be your voice, your proxy. Wow. I mean, that's, when you talk about end-of-life care, that's a huge loss for a hospice patient.
Oh, it totally is. It totally is.
When someone you know is going through grief and loss or a difficult life change, a care package from BeyondWordsCo.com is the perfect way to show you care. Founder Katherine Hines learned through her own grief experience that the gift responses we offer could be so much better. Whether you're wanting to show support to someone dealing with a challenging medical diagnosis or encourage a friend going through a difficult life transition, Beyond Words can create a care package for someone you care about. The care package items are thoughtfully selected, sensitive to the grief experience, and come in earth-friendly packaging. Each item included in a Beyond Words care package has been hand-selected to bring comfort and honor self-care. Even the colors are chosen with intention, in shades of sky blue, restoring greens, and peaceful earth tones to calm, soothe, and uplift. They can even design a care package that's appropriate for workplace giving. Order your care package at beyondwordsco.com today and ensure that your loved one doesn't feel alone during life's toughest times.
So what advice would you give? And of course, I already know the answer to this, but I want to hear how you would say it. What advice would you give to hospice professionals about how to take better care of our community members who also happen, oh, by the way, to be part of the LGBTQ community?
And probably part of your families, although if you have enough bias, they may not tell you.
True.
Which is a loss for those team members as well. I start with people should have some education, because what's different about the LGBTQ community is, unlike other cultures, I'm Swedish and Norwegian. I have that culture. It's inherited. It's part of me, right? But when you are in the LGBTQ community, you have a culture that you become part of and a history you become part of that you don't share with your other family members. You share it with the community members. And the trauma that has been through that community comes down to the newest members. And so you need to be aware of that history. You need to know what terms to use. The youngsters in our community, who are those 30 and under, as far as I'm concerned, they really like using the word queer. I hate that word.
Oh, well, so you and I are about the same age. Queer was derogatory.
It was, and it was leveled at me a number of times. And
right.
I had someone hit me with the Bible using that word. Literally, they threw it. Right? I don't like that word. It's not a friend of mine. And I had somebody trying to tell me I had to use it because I was being biased against myself for using the word lesbian. I'm like, no, I earned that word. It's mine. And you can't tell me. You can't tell me what pronouns, and you can't tell me what word. Right? So we need to make sure that we're educating our hospice teams about the history of the community and truly what it means. What was Stonewall? What is pride? Why is that important? It's not about so much what other people look in. It's the being there and being part of it. And that's an important part of community membership. Even if someone only goes to one pride parade, they never forget that. And you can ask any person you're talking to, and they will remember the first time they were in that street and everybody there was warm and a little bit crazy. And that's something that comes from being enveloped in a culture that you didn't grow up in.
Right.
You also need to be aware that a lot of people in the community have had religious trauma. And so the chaplaincy staff in particular need to be really, really cautious and not assume. If they see I was raised XYZ, don't assume they still are, because that may have gone south the minute they came out. Especially if they're in some of the more closed religious communities. And once you've got that and yet people understand that pronouns are a thing, which is something that us oldsters do stumble over, I will tell you, we have to remind ourselves to use, the right pronouns as well. We stumble with they and them just like everybody else. But we do it because we understand the need for respect.
Yes.
And the need to see someone for the whole of who they are. We also need to train our teams to really understand who the couple is. And if they say they've only been married 7 years, that doesn't mean they've only been together 7 years. That means they had to wait for the United States Supreme Court.
Right.
Right? I have a picture of Casper where she's holding a sign that said, some people have to ask their parents to get married. I had to wait for the Supreme Court. Right? Wearing her Hawaiian shirt. It's one of my favorite pictures of her. That's something that is not something that team members are truly aware of, because when you're straight, you grow up with the assumption that I get to get married when it's time. Not when you're gay and lesbian, not when you're trans, and coming up probably not in the future. There's that every likelihood. And so there's that piece as well. And not to see if someone's not married, that doesn't mean they're not in a committed relationship. They may not have gotten married after they could legally because they were afraid from the trauma previously from the federal government and state governments about who they were.
Right.
Right? When Linda and I were first dating, we didn't go to Utah for vacation one year because Utah was still arresting gays and lesbians who were renting hotel rooms together.
Mm-hmm.
The police would come in and tear down the door, and you'd go to jail just for renting a room together. I'm not quite 60. That says a lot to me. It's like stormtroopers. So,
Yeah.
and I actually am a very loyal American, and I do actually respect all the laws. It's not that. There's a lot of trauma. So we also then need to work with our teams to understand that when they are going into an LGBTQ home, that it is their job to be that best supporter. And if they have a bias, they need to remove themselves from the team, because they don't need to go in there feeling like they can say something like, I never approved of your marriage, because it's not ours to approve of who a person is. It's not ours to approve their heritage. It's not ours to approve their income status. And it's not ours to approve who they love, how they love. What happens if they're polyamorous? There may be multiple people. It's a stumbling block. We need to get over it. That's who people are. It's their death. They deserve the dignity in their end of life and their death, and their survivor deserves the complete support of that hospice team.
Exactly.
Without reservation.
I think it's super important to remember that, you can make a laundry list. This patient has COPD. This patient lives on this side of the tracks. This patient has a degree or does not have a degree. This patient's an engineer. This patient's been incarcerated. This patient's in the LGBT community. Those are only descriptors.
Mm-hmm.
What's basic and the same for everybody is it's a human being.
Right.
Someone who needs care. And I think it's so important to connect my humanity as a hospice nurse with the humanity of the patient and the caregiver, family of choice, blood family, whoever they've decided is a caregiver, their next of kin and significant other. But to connect with the humanity, not basically what turns out to be labels.
Right.
Yeah.
Because, we have to be careful. Sometimes hospices, you get into team meetings and a person becomes a diagnosis.
Exactly. Right.
Yeah. Well, this next patient is a such and such cancer and this and that. And they're like, wait, what was their name?
Yeah.
Can we go back to that name?
Yes.
Yeah. Yeah. Let's talk about Sandy Sue, and let's talk about what's happened with her, and let's look at the whole of her and who are the people in her world, not the diagnosis first.
Right. We were people way before we had the diagnosis.
I hope so.
I would hope so. Right? We're more than just the sum of all that medical H&P.
Right. And we want to make sure that we're treating people with that level of respect. And we want to make sure that if we are looking at an LGBTQ community member, if they have a partner, we're treating them like a partner. We're not treating them just like a caregiver, just as we would with anybody else.
Exactly.
Right. And that's a stumbling block if it's a straight couple or a gay couple, but we need to make sure that they are being recognized as losing their spouse.
Right. They should be in bereavement. They should have grief support just like everyone else.
Mm-hmm.
No different. So I'd like to talk about the team conference, about the IDT meeting. Because, a lot of times the way we talk to patients and families is different from the way we come back to the office and we talk about them. These people are stubborn. This guy's a pain in the butt. These people are uncooperative. And I've heard really bad descriptors in team meetings. Mm-hmm. And I know a lot of times it's based on frustration. They're not doing what we think they should do, or maybe they're not engaging in everything we have to offer. We know it could benefit them and they choose for whatever reason not to. What about those conversations that we have internally? What guidance would you offer for hospice professionals that are sitting in on those team meetings and having to figure out how to have respectful conversations?
I want them to think about how they would want to be talked about, and how they would want their partner or parent or child to be talked about. And I want them to come at it from that perspective. And if they hear someone in that meeting referring to someone in a derogatory way based on being part of that community or any other, to turn it around. Now, sometimes you don't have the power to say something, but you can go to a supervisor and say, I think we need to revisit this. And I think we need to have some kind of in-service or something because this was not okay.
Right.
And I think it's important if you have a member of the community in that team room who's hearing it and nobody stopped it, it's incumbent upon the other people who are not part of that community to go to supervision and say, we need a redo and we need to address this. So it doesn't fall on that person to have to defend their community and feel isolated. That's not fair.
I sat in with a team as a field nurse years ago and experienced something very similar to what you're talking about. Had a team member who went out to a death of a woman whose son was gay. And when the death call, the death visit was made, the son was extremely emotional. He was just overwrought, very overwhelmed in his grief. So when the nurse came back to give the report, talking about to the team, the bereavement coordinator, talking about what the bereavement needs would be, she was talking about how his response was what she considered over the top. She described it as dramatic, and she ended up calling him a flamer. A flamer. And I was offended as the parent of a gay child.
Yeah.
And there were other people in the room who were offended. And I ended up going into my boss and I said, this just happened and I'm not okay with that. I'm not okay with that. And I remember thinking, what comfort level are we supposed to have with that?
We're not.
It was horribly offensive to so many people. So I'm a middle-aged straight white lady, but that was offensive to me.
And you said something.
Yes.
And that's important.
And of course, I don't know what the consequences were after that. But the fact that someone had the comfort level to use that term, that's like saying queer to me. It's, that's offensive.
Those are terms we reserve for our community. Like there are lots of times when we use terms like that, but we use them within our own closed community. And that's perfectly acceptable, but it's not acceptable when it's used by someone outside the community and not used in a derogatory way.
Yeah. And this was definitely derogatory. It was not a respectful conversation. It was a little shameful to be part of an interdisciplinary team that had that culture.
Right.
Yeah.
Right. And that flamer comes from Flaming Queen, which is part of the initial part of the establishment of the community in the public eye, which goes back to Stonewall. And that's where that respect goes to that. And that's being used in turn as a disrespect by someone outside the community. It's a huge breach of what's acceptable. And had that family picked up on that, because they do, when you are part of a community that gets targeted a lot, your ears are always perked for who's saying stuff because we pass well, right? I'm a middle-aged white lady. I'm a grandma, right? I'm the one who wears the crazy dog lady shirts. You don't know when you're, out in public that I'm a lesbian and I've been married to women since I was 22. You don't know that. So when you say stuff, I hear it. Right. And I can feel it. And when you're feeling that way in someone's home and they've just had the death of a beloved parent whose death has caused such pain, I can't even imagine what that son must have felt like when that nurse left.
And I'm a firm believer that the internal conversations we have with each other as hospice professionals are reflected, whatever disrespect or poor culture biases. I think that's always reflected in our care. You can't keep it out of how you interact with your patients and families. You may think you are, but I just don't think that's possible.
It's not. The nurse who was so disrespectful the day Casper died, when she'd been there previously, and Casper was really struggling to express herself, because Lewy body dementia, you can express and then you can't express. It goes back and forth. But she had such a need to tell everyone on every team visit that she loved me and that she wanted me to be taken care of. And she was grateful for the care, but I was an inherent part of all of her conversations, that team member would shut down that part of the conversation each and every time.
Wow.
She went back to symptoms. She went back to other people in the family. She didn't want to talk about Casper having been in a relationship with me. And I was standing there, but it was important. It was Casper's need to say those things. And that meant it needed to be heard.
And that's very typical of patients at end of life. They want to know that their caregivers, their loved ones, their family members are going to be okay. And they want to know that they're well taken care of.
That's their greatest fear at death, is that their loved ones aren't going to be okay.
Exactly.
It's the one thing they need to hear. I'm going to be okay. I'm going to miss you, but I'm going to be okay.
Right.
I'll still be here.
So if you could have, not a do-over, but if you could have the opportunity to talk to the hospice team that took care of you and took care of your wives at end of life, what would you want them to know about who you are and what you needed?
I would want them to know where we had come from. I would want that psychosocial to be thorough so that that history would be known, and I'd want them to read it because that's got all the information, I hope. And I would want them to know that our relationship really mattered, and that for every gay and lesbian couple, that recognition really matters because it took so many thousands of years for them to be recognized, literally, right? In this country, 250 plus years. And that the greatest fear for a gay and lesbian couple or a trans couple or any other member of the community is that we are going to be disrespected and that you're going to care for us differently than you would somebody else.
Good advice. Good advice for any hospice professional.
Mm-hmm.
Jill, you're so generous with not just what you know professionally, your grief counselor hat, your social worker hat, but sharing your experiences and things that were difficult for you so that other people can have a better end-of-life experience. So grateful. Tell the listeners how they can connect with you and order your books.
You can find me at jilljohnsonyoung.com, which still sounds weird to me as a social worker. No hyphens, no caps, or at therebelliouswidow.com, no hyphens, no caps. And you can find me on Fridays live on Facebook at the Friday Grief Chat on Facebook, which is where I chat with my good friend Deb about all things grief and anybody else we pull in that has some things to say. And you can buy my books on Amazon. I have The Rebellious Widow, which is how to get through end of life, hospice, and grief. And it's not just for widows and widowers. And you can find my children's books and my grief workbook at jilljohnsonyoung.com. They're all on Amazon. They are all on Prime. You can have me in your house tomorrow if you are brave enough to do so.
I have a copy of The Rebellious Widow. It's one of my favorites. It's shocking and educational and funny all at the same time. A little irreverent, right? A little rebellious.
Irreverent is necessary when you're talking about end of life and grief because you have to laugh.
Absolutely. You're such a blessing to us today, Jill. Thanks for talking with me.
Thank you for having me.
I learned something from Jill Johnson Young every time I have a conversation with her. She's really a unique lady, but I'd have to say in some ways she's really not. Sorry about that, Jill. I think you would not like that. But she's just another human being, just like everybody else. And I think that's what she's saying more than anything else. In her hospice experience, she just wanted her wife, Casper, and both her wives to be treated with dignity and respect and understanding and compassion. So I think Jill's interaction with the hospice team member, in fact, one of her wives, her dying wife's fellow hospice team members, which blows my mind completely, this team member with an obvious bias. It's so important that interdisciplinary team members working in hospice be aware of how our words impact people, how they impact people. And when you think of impact, I'm talking about a throat punch, how you impact people. We don't need to voice our opinions. That's not the work we are there to do. That's not our jobs. Professionals should know that we are coming to patients and caregivers in their most vulnerable moments, their most fragile moments. These moments that are intense and overwhelming, and moments that they will carry with them, the caregivers, for the rest of their lives. It's legacy. It's a legacy. What kind of death legacy are you helping those caregivers to create? We don't have to agree, endorse, approve, or even believe in anything that our patients are or they believe in, but we do have to treat them with compassion and respect. So I really hope that if you've listened to this episode, that you've heard the lessons that Jill has shared, the lessons that she would teach hospice professionals, and the compassion that she would show to people in the LGBTQ community. And I would offer that we're all one community, the human community. And if we provide our care from that mindset, we're going to provide it well and make everyone feel as if they've received the compassionate end-of-life care that they deserve. Be sure to catch the next episode of the Heart of Hospice podcast. You can find more episodes on theheartofhospice.com, and don't forget to subscribe on your favorite podcast platform. You can connect with the Heart of Hospice on Facebook and Instagram, and send your questions or comments by email to host@theheartofhospice.com. And remember, no matter who you are or where you are in your hospice journey, you are the heart of hospice.